Initiative for Health Accountability and Transparency. Welcome you to continuing medical education course on attitude, ethics, and communication, Aetcom. Module 1 on attitudes. The outline of this module is learning objectives, introduction of key issues on attitudes. We'll look at pre-service curriculum and training of medical and allied professionals. We'll also discuss justification for the initiative on attitudes, definition components, and functions of attitude. We'll look at positive and negative attitudes, discuss the benefits and effects of positive attitudes. We'll also look at characteristics of attitude, factors affecting attitudes, and the ways of changing attitudes and the barriers affecting this change. And then we'll take conclusion. The learning objectives of this module is that at the end of this module, participants will understand why attitudes of medical and allied professionals have profound effects on medical practice, delivery of quality healthcare, and patients' safety. They will also understand the justification for initiatives and interventions on attitudes, understand the definition, components, and functions of attitude in healthcare. They will understand the rationality of program on attitudes, describe the domains in medical and allied professional training programs. They should also be able to describe positive and negative attitudes in healthcare, understand the characteristics of attitude and the factors affecting attitude, and finally describe the ways of changing attitudes and the likely barriers. In healthcare work, attitude is very important. It is important because it governs an individual's everyday encounter in healthcare delivery. Medical and allied professionals include physicians and other health workforce, which includes professional nurses, midwives, the pharmacists, laboratory scientists and technicians, and all others engage in actions whose primary intent is to enhance health. The medical and allied profession has always been regarded as not just a job, but a calling, involving selfless service to humanity and putting the patient's interests above everything else. And to many people, the work of medical and allied profession is nothing but caring, kind-hearted, compassionate, empathetic, and humanitarian service. Therefore, medical and allied professionals are expected to act in a respectful, courteous, and civil manner towards their patients, to their colleagues and co-workers, and others involved in the provision of health care. Doing so fosters an atmosphere of trust, shared accountability, and collaboration, and is an essential component to upholding the values and principles of medical professionalism. When appropriate attitudes, communication, and ethical strategies are applied in healthcare delivery, there is an enhancement of quality of care and the satisfaction of the patient. Similarly, behavior that is unprofessional or disruptive undermines medical professionalism and the trust of the public. Literature has shown that attitudes of providers can negatively impact both the delivery of quality healthcare, the patient safety, and health outcomes by eroding the effective communication and collaboration that underpin good medical practice. Now, let us take a brainstorming session. Is there any justification or justifications for intervention on attitudes of medical and allied professionals? You may wish to take your notebook and pen and note down, in your opinion, what is or are the justifications for intervention on attitudes of medical and allied professionals. Looking at the justification, the first thing that comes to mind is lack of due attention. Teaching medical ethics, behavioral science, communication skills, and managerial skills do not receive due attention in the existing medical curriculum as they should do, and that is both at pre-service or professional level and also during the service. The second justification has to do with unfavorable work conditions. The working conditions for medical and allied professionals are often not ideal, with long hours of work, with early burnout, and harassment by the relatives of the patients. In addition, there is the great issue of feeling professional isolation and also disparity in the living conditions, particularly in the rural areas. All this can lead to job dissatisfaction and negative attitudes. The third justification is that there is inadequate focus. The focus primarily on affective domain. The affective domain is often not sufficiently addressed in the pre-service professional trainings and also in the in-service training programs. The curriculums do not appropriately support the medical and allied graduates to handle the stressors which often lead to professional dissatisfaction with undesirable negative attitudes and consequences. Looking at pre-service curriculum and training, medical curriculum and training programs have been designed around 3 specific learning objectives, which are cognitive, psychomotor, and affective, and also known as the head, the hand, and the heart. Under the current scenario in Nigeria, medical education deals greatly with the head, miserably with the hand, and nearly neglects the heart. Consequently, we are producing physicians and allied health workers who would understand and provide holistic and comprehensive healthcare, which are preventive, promotive, curative, and palliative, but often failing in compassion and in humanitarian flavor. Due to failings in compassion, there is increased level of mistrust of the general population upon the medical and allied professionals due to negligence, misconduct, and unethical practices. Therefore, building attitudinal, ethical, and communication competencies in all phases of learning can be a core strategy that can be adopted to address the mistrust of the general population. We mentioned the domains of medical and allied professional training before, and the scenario of the head, the hand, and the heart. And we mentioned cognitive, which is the head, and deals with knowledge, comprehension, application, analysis, synthesis, and evaluation. We also mentioned the psychomotor, which is the hand, and this addresses skills related bodily movements, visual, auditory, tactile, or coordination abilities as they relate to the patient, the environment, and also the reactions. And then the affective, which is the heart, and this area is common with feelings or emotion, and is the most important area that determines the attitude of a care provider. Looking more deeply into affective domain, the affective domain is the heart and is the nearly neglected. The domain covers an individual's emotional behavior, such as his or her feelings, values, apprehension, enthusiasm, motivations, and attitudes. Addressing this domain would in turn inculcate interest, values, empathy, and develop appreciation and attitude for interpersonal as well as community interaction and relationship. Hence, for the overall development of a medical or allied professional, the affective domain comprising attitude, communication, and ethics will need to be impacted directly and also explicitly. Aetcom program is designed to help strengthen medical and allied professionals to effectively fulfill the functions of a leader, a manager, and a member of the health team, a communicator, a lifelong learner, and above all, a great professional. The subject of this module is on attitude. What do we mean by attitude? Generally, attitude is a behavior a person adopts towards other people, other things, to incidents or happenings. Attitude influences an individual's choice of action and responses to challenges, incentives, and rewards. These are all together called stimuli. Attitude is composed of three components, which include a cognitive component, an affective or emotional component, and behavioral component. Let us look at them one by one. This program and like we mentioned earlier, there are three components: cognitive component, affective, and behavioral component. Let us take the components one by one. We start with cognitive component. Cognitive component refers to that part of attitude which is related in general knowledge of a person or the information that is available about the person. Basically, the cognitive component is based on information or knowledge. The cognitive component of attitudes concerns the beliefs, thoughts, and attributes that we would associate with an individual. It is the opinion or belief segment of an attitude. Looking at behavioral component, it refers to that part of attitude which reflects the intention of a person in short or a long-term run. Behavioral component of an attitude consists of a person's tendencies to behave in a particular way towards an individual. And using this example, the behavioral attitude may be, I cannot touch a patient with a particular illness, or we better keep those types of patients out of this hospital. Looking at the affective component, the affective component is based on feelings and is the emotional or feeling segment of an attitude. It deals with feelings or emotions that are brought to the surface about something. It could be a hate, or it could be a fear, or it could be a likeness. A medical professional or provider might have the attitude that they hate a particular group of patients and will be hostile to any patient that falls in that group. Let us look at the functions of attitude. Attitudes may serve different purposes depending on the person who holds it, but 4 functions of attitude have been identified: adjustment function, ego defensive function, value expressive function, and knowledge function. Let us look at each of these functions individually. We start with adjustment function. Attitudes often help people to adjust to their work environment. When employees are well treated, they are likely to develop a positive attitude towards clients, management, and organization. And this is true for all organizations. But when employees are criticized and probably underpaid, they are likely to develop a negative attitude towards clients, management, and even the organization. On ego defensive function, this refers to holding attitudes that protect one's self-esteem or that justify actions that make us feel guilty. And mechanisms of ego defensive functions includes denial, repression, projection, or even rationalization. We have value expression function, whereas ego defensive attitudes are formed to protect a person's self-image. Value expressive attitudes enable the expression of the person's centrally held values. And these values tend to establish our identity and gain us social approval, thereby showing us who we are and what we stand for. Looking at the knowledge function aspect, in the absence of knowledge about a person, we may use a stereotyped attitude for judging the person. But knowing a person's attitude helps us predict his or her behavior. People ascribe causes to events and direct attention towards features of people or situations that are likely to be useful in making sense of them. Moving to positive attitude in healthcare. Positive attitude in healthcare is not a choice, but a necessity. Medical and allied professionals should be sympathetic, humane, and hospitable to patients. Attitude is vitally important in the healthcare field. As a medical professional or a nurse, patients are affected by everything we do. This includes the attitude and demeanor. They are care providers, and the positive attitude they portray is infectious when it comes to patients. They will feel they are getting compassionate care from an individual who has their best interest in mind. It should be noted that these days, employers are not looking for those with first-rate skills only, but people with positive personality, with good attitude, and interpersonal skills. Individuals who have positive attitude will pay attention to the good rather than bad in people or in situations or events. They will always think positive. A simple example of a positive attitude is when you are having a very bad day and fatigued, you still manage to say, "What can I do to help you?" rather than, "I can't just do anything for you." Does it remind you of someone or a past event? Positive attitude has great benefits. Regardless of what medical and allied health profession one works in, a positive attitude can make a big impact on career development. It can help to increase optimal and consistent performance. It should also be noted that a positive attitude is advantageous, from dealing with stressors of the job to creative solutions to problems and to managing interpersonal relationships with superiors, co-workers, and clients. Positive attitude is advantageous. Positive attitude also helps to reduce accidents or unintended incidents. If you are in a bad mood, there is a good chance that you are mentally distracted by what's bothering you, and you may not even realize it. When you aren't focused, you are more likely to give less than your best care. This can invite errors, injuries, or even accusations that you have not delivered the care that the patient expects from you. Fifthly, it earns a good reputation and advance in career development. People with good attitudes are better able to handle job stress and are more constructive in approaching difficult situations. These are fundamental characteristics employers look for when considering employees for promotion and advancement. It's also a sure way to get a glowing reference if you decide to change job. On negative attitude, medical and allied professionals should avoid hostile and contemptuous attitude towards patients. People with a negative attitude ignore the good and pay attention to the bad in people's situations and events. For example, when a woman is in labor and has so much pain, but there is this person, a provider, who complains and goes on to insult her, seeing her as a nuisance. That person has a negative attitude, forgetting that the family is expecting a baby? Does it remind you of someone or a past event? There are what we call characteristics of attitude, and there are quite many. Attitudes are a complex combination of things we tend to call personality, beliefs, values, behavior, and motivation. It can fall anywhere along a continuum, from very favorable to very unfavorable, to very negative to very positive. All people, irrespective of their status or intelligence, hold attitudes. All attitudes exist in every person's mind. It helps to define our identity, guide our actions, and influence how we judge people. Although the feeling and belief component of attitude are internal to a person, we can view a person's attitude from his or her resulting behavior. Furthermore, attitude helps us define how we see situations, as well as define how we behave toward the situation. It provides us with internal cognitions or beliefs and thoughts about people and objects. Attitudes cause us to behave in a particular way towards a person. An attitude is a summary of a person's past experience. Thus, an attitude is grounded in direct experience, predicts future behavior more accurately. It includes certain aspects of personality as interest, appreciation, and social conduct. It indicates the sum total of a man's inclinations and feelings. An attitude is a point of view, substantiated or unsubstantiated, through a force which one holds towards an idea, object, or a person. It has aspects such as direction, intensity, generality, or even specificity. It may be positive or negative, and it may be affected by age, by position, and even by education. There are differences between positive and negative attitudes. Let us take a look at our healthcare institutions and facilities. From our experience, what differs positive attitudes from negative attitudes, and how can we identify them? You may think about this poster and put key points down. There are positive attitudes and negative attitudes on your right and on your left, and the difference between them are clearly described. Individuals who have positive attitude will pay attention to the good rather than bad in people or in situations, while on the negative side, people with negative attitude ignore the good and pay attention to the bad in people, in situations or events. Positive attitudes are rewarded. It means the individual is encouraged to do the same thing in future, while negative attitudes are punished in order to discourage the same action in future. If we think positive thoughts, we will surely experience such emotions as joy, love, gratitude, peace, and hope. But if we think negative thoughts, we will definitely have negative feelings such as anger, disappointment, irritation, and envy. Positive attitude is an optimistic approach for a person to achieve good results, while negative attitude is a pessimistic mindset of a person who is not capable of handling critical issues. Positive attitude is a process of solving problems, while negative attitude is a process of looking for problems. Positive attitude are persons that always see opportunities, while negative attitude persons see only limitations. Now, there are factors that affect attitude, and there are quite a good number of them. They include social factors. Social roles and social norms have had a strong influence on attitudes. Our attitudes may facilitate and maintain our relationship with members of positively valued groups. We also have direct instruction. Sometimes direct instruction can influence attitude formation. We have family factors. Attitudes developed by an individual, whether positive or negative, may be as a result of family influence. Usually, these attitudes are very powerful and difficult to change. We also have prejudices as a factor. An attitude may involve a prejudice in which we prejudge an issue without giving unbiased consideration to all the evidence that is available. There's issue of personal experience. Personal experience have left a strong impression. Some attitudes will be more easily formed when personal experience involves emotional factors. We could also have media. The mass media has a major influence in shaping people's opinion and beliefs. There are educational and religious institutions. As a system, educational and religious institutions have a strong influence in shaping attitudes because they lay the foundation of understanding and moral concepts within an individual. And finally, there are physical factors. Here, clinical psychologists have generally recognized that physical health and vitality are important factors in determining adjustment and have frequently affected positive or negative evaluations. There are barriers to changing attitudes. Employees' attitude can be changed, and sometimes it is in the best interest of teams, management, organizations to try to change attitudes of employees. However, the process of changing attitudes is not always easy. There are barriers, and management organizations should be aware of this and should take corrective actions. The barriers to change include prior commitment. If you are committed to a cause, the attitudes that will guide you to achieve that commitment certainly will be a barrier. We have talked about the role of information. When you have insufficient information about a person or event or circumstances, the attitudes formed based on that might not be easy to change. There is also the balance and consistency. Those who are not balanced and inconsistent are likely to resist change. Resources are required for attitudinal changes, and also when you have improper reward system, it doesn't encourage change of attitude, and then resistance to change is always common in every event in life. Let us look at changing attitudes. Attitude can be changed if we differentiate negative attitude from a positive attitude. A positive attitude can bring positive change in life. It is difficult to change attitudes, but with some effort, it can be done. The individual from a culturally deprived environment who holds an array of hostile attitudes may change often. He is given opportunities for education. So education, in whatever form, is important in the process of changing attitudes. Furthermore, a person from a privileged subculture who has always held to a democratic attitude may become negative towards some group because of one unfortunate experience. So past experience is a very key to changing attitudes. And also, well-established attitudes tend to be resistant to change, but others may be more amenable to change. Now, what are the ways of changing attitudes? Information is very important. New information will help to change attitudes. Negative attitudes are mainly formed owing to insufficient information. Attitude may change through direct experience. Another way in which attitudes can be changed is by resolving discrepancies between attitudes and behavior. Change of attitude can come through the persuasion of friends or peers or colleagues. Attitudes may change through legislation, or extant guidelines, or standard procedures that we have in place, and the code of conduct. Since a person's attitude are anchored in his membership group and reference groups, one way to change the attitude is to modify one or the other. And also, fear can change attitude. If low levels of fear are used, people often ignore them. So it should be high level of fear. Let's look at a case study, a newspaper report from Vanguard. And this particular issue is on how poor attitude of health workers is killing healthcare delivery in Nigeria. You may wish to connect to this link. What are the issues from this study? The key issues are that the impact of negative attitude to work by healthcare providers in public and private hospitals in Nigeria is particularly worrisome. I don't think this is new to any of us. Years of poor attitudinal problem, particularly in the public sector, has further endangered lives of patients, many already in critical condition. There are similar issues recently. I'm sure you will recall of issues of abandonment of patients or refusal to treat patients in emergency. Investigations by Good Health Weekly shows that the attitudinal problem is at every level of care. That is, there is no exception. And all cadres or healthcare providers are guilty of this negative attitude. And that it does not follow whether a dying patient is in emergency room treatment, routine doctor's appointment or laboratory test, blood bank, or any appointment for that matter. The negative attitude seems to have become a way of life. What the reporter is saying is that the negative attitude has become a norm and is doing more harm to the health sector than good. Critical observers of the view that health institution is losing its focus on genuine concern for patients. Like we said earlier, it is all about a calling. It's not about the work, and it's based on compassion. Unfortunately, there is shift of emphasis to material possessions. The report says that many providers see patients as a nuisance. They see them as too demanding and also waste of time. The critical thing here is that the report has suggested that the major flaw is very significant and it requires urgent reorientation of health workers and putting measures in place to monitor the activities of medical professionals. Let us take this assignment Attitude can be described as a tendency to react positively or negatively to a person or circumstances. And attitudes can be positive and negative. You are required to identify 5 positive attitudes and 5 negative attitudes in healthcare setting and do an online submission to be marked LMG assignment of not more than 500 words on the above issue to IHAT@gmail.com. The conclusion of this module is that medicine as a profession depends on individual skills and expertise. However, to a large extent, it relies on relationship within the group and its communication outside the group, that is, towards the patient, the family, as well as the community. Good behavior, appropriate attitude, proper and timely communication, and empathy are crucial components of medical practice. And for the overall development of medical or allied health professional, the affective domain comprising attitude, communication, ethics would need to be impacted directly and explicitly. And finally, training of medical professionals and healthcare providers in attitudes, ethics, and communication domains will help them to become a committed skill provider on whom people can trust. Our dream for a strong health system and better health outcomes will remain a dream unless we work for it. And working for it will require change in mindset on attitudes, on medical ethics, and also on communication. It requires strong leadership, effective management, and transparent governance. IHAT is committed to the triple concepts of leadership, management, and governance.